Getting tested is the only way to know for sure if you have COVID, but it likely requires taking time off from work, and at-home rapid tests are flying off the shelves. WCNC Charlotte's Chloe Leshner live at the Charlotte Mecklenburg Library on South Boulevard. Chloe, are they giving the test or the free test again?
Hey, Fred. Well, the demand was so high, they gave out 35,000 of those tests in just a few hours last week, but they are still waiting for another shipment to come in so that they can give them out again. That, of course, is driving a lot of people to go and buy those at-home tests if you can find one at Walgreens or CVS, but it's about $25 for 2 tests, and for some people, that's just too expensive. With Omicron spreading at an unprecedented rate, knowing who is infected is key in getting the virus under control.
The bottom line is that we want to make sure that everybody has access to tests.
But it's been easier for some. In the last month or so, getting a test in the Charlotte area has been an hours-long process, and not everyone can afford to miss work to sit in line. On Wednesday, the federal government will start taking orders for free at-home tests.
We have 1 billion tests that will become available to people that they can order through the website.
There will be a phone line to accommodate those who don't have internet access. As COVID becomes more endemic, at-home tests will likely become a staple on pharmacy shelves, but the cost can add up. Private insurance companies will now cover up to 8 at-home tests a month. Dr. Cameron Webb with the White House COVID response team says they're working to make the same resources available to all families to ensure the inequity gap doesn't widen.
We're sending free tests to community health centers, sending free tests to organizations, for instance, to help people experiencing homelessness.
The CDC is now also recommending N95 or KN95 masks. Of course, those too are more expensive, but Atrium Health has vowed to donate 1 million KN95 masks to different community groups. So for any organization interested in getting one of those donations, we have more information on how to reach out on our website, WCNC.com. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Chloe, thank you. And so we heard Chloe just touching on this too. Private insurance companies will now cover up to 8 at-home COVID tests a month, but millions of Americans won't get to take advantage of this. The latest census data shows that 8.6% of people don't have health insurance. That's 28 million Americans. Also, Medicare is not required to cover the tests, but we're told some plans might offer coverage. Medicaid, however, is required to cover the at-home COVID tests.